Hi, Mr. and Mrs. Antar. My name is Meranda Morgan. I am your student nurse, and I've just been asked to go over some information with you today about what happened to you and how we should move forward with the treatment. So first, I just wanted to explain what an ST segment elevation myocardial infarction is. It is commonly called a heart attack, which is caused by a complete blockage in the coronary artery, which is just the artery that delivers oxygenated blood to your heart. So it's just like the oxygen is the food for your heart, and it helps your heart stay alive so that it can keep beating. It can keep beating the blood to all of your body. But when these arteries are blocked, the heart cannot get enough blood for the muscle, and it causes these cells to die. And if the problem is not, the longer the cells go without oxygen, the more cells die and the more damage that occurs. So it's very important to treat fast. And so to diagnose this, we just had an ECG on you. This measures the electrical activity in your heart. So the ST segment that represents ventricular activity. The STEMI is diagnosed if there is a greater than a 1 to 2 millimeter elevation of the ST segment in 2 continuous leads on the ECG. And then the patient also has to be experiencing pain in the clinical situation to be diagnosed. And these ST segments have a tombstone appearance on the ECG. So next, I just want to go over why this happened to you and some things we can do to help prevent this in the future. So some modifiable risk factors for a heart attack include high cholesterol, obesity, poor diet, smoking, and lack of exercise. So one thing we could do is to get you on an exercise regimen. This activity, you always want to have a warm up and a cool down period of 3 to 5 minutes every time you exercise. So to start out, we just want you to exercise moderately, walking, maybe swimming, as tolerated, and you should work up to 30 minutes, and then you should be doing this almost every day of the week. And so some other things, your diet needs to be modified. The doctor has ordered a low-fat diet for you. So a low-fat diet, we just want to limit the fatty foods, especially the saturated fats. So these are foods with lard or bacon or whole milk. We want to get more of those good fats like fish, like the oils in fish, like omega-3. And also, just to protect your heart, we want to keep you on a low sodium diet as well. So this is 1,200 milligrams of sodium a day. Some things you can do to keep low sodium: eat some shredded wheat cereal instead of scrambled eggs and bacon. Those can be very salty. Some fresh fruit and yogurt and granola, things like that. Foods that aren't processed. Fast food always has a lot of sodium in it. We also want you to cut out red meat 3 times a week and replace it with chicken or fish. This will really help cut out some sodium, get some good fats. Yeah. And then, so for our plan of care for you, right now, for the next 2 hours, we need you on bed rest with your head flat and your legs straight for 2 hours because you just had a stent placed, and we don't want any complications with that. The nurse will be in here regularly to monitor for any bleeding or a hematoma. Also, the doctor has started you on Lipitor. This is 10 milligrams to take once a day at bedtime. This medication was prescribed to decrease your risk of heart disease. Some side effects you might notice are abdominal cramping, heartburn, constipation. But you want to contact your doctor immediately if you have any muscle pain or weakness. This can be a very adverse effect called rhabdomyolysis. Also, the doctor has prescribed Plavix, 75 milligrams 4 times a day starting tomorrow. This will help prevent clots, which is what caused your heart attack, and so it just prevents the clotting factors in your blood from sticking together and forming clots, and then those clots go and block smaller arteries and block blood flow to like your brain or your heart. So this medication just prevents those clots. Um, you might notice some dizziness, fatigue, abdominal cramping, but you really want to watch for bleeding because this is an adverse effect. Watch for like black tarry stools, bruising, bleeding gums. You should contact your doctor if any of those occurred. All right, and we already went over diet modifications, so that's about it. Do you have any questions? Thank you.